If you're dealing with dizziness, feeling off balance, or that weird I can't quite trust my body right now feeling, this is what's likely happening and what actually helps. The Calibration Brain Body, one of the biggest things we want people to understand is this. Dizziness is a symptom, it's not a diagnosis. And once you understand the pattern behind it, treatment gets a whole lot clearer. So what is it? Dizziness can mean very few different things. For some people, it feels like spinning. For others, it feels like lightheadedness, unsteadiness, or feeling overwhelmed in busy environments like grocery stores, crowds, or even while scrolling on a phone. One of the biggest myths we hear is that it's probably just my inner ear. Sometimes the inner ear is a part of it, but balance is really a team effort between your inner ear, your eyes, your brain, and your body awareness. Another myth that you should just rest until it goes away. In many cases, too much rest actually slows down your progress. So why does dizziness persist? Dizziness can hang around longer than people may expect. When one part of your balance system gets irritated, whether that's the inner ear, the visual system, the neck, you have a migraine disorder, or a post-concussion problem, your brain starts getting mixed signals. Then a lot of people do what makes sense in the moment. They avoid movement, stores, workouts, driving. Just try not to trigger symptoms. The problem is that avoidance can lower your tolerance even more. So now the system gets more sensitive, not less. That's when dizziness starts shrinking your world. The good news is that with the right plan, the brain and the body can be retrained, and a proper assessment is a big part of that. This is exactly why guessing isn't a good strategy with dizziness. At Calibration Brain and Body, we start by figuring out what kind of dizziness you're actually having, the triggers, how long it lasts, and what systems need to be involved. We look at positional triggers like rolling in bed or looking up. We assess eye movements, visual tracking, gaze stability, balance, gait, and when needed, standing related blood pressure changes. We screen for neurological concerns and coordinate referrals. And just as important, we always watch for red flags. Stroke symptoms like facial drooping, weakness, trouble speaking, sudden severe headaches, fainting, chest pain, or a sudden major walking difficulty. Those symptoms need urgent care right away. Once we know the right pattern, treatment becomes much more targeted. Phase 1 is about calming the system down and creating stability. That may mean addressing a likely driver early, reducing pain, reducing symptom spikes, starting gentle visual or vestibular drills, and giving you clear rules so movement helps instead of overwhelming you. Phase 2 is about restoring motion tolerance and visual vestibular coordination. This is where we build your ability to handle head movement, visual motion, and balance challenges in a safe and progressive way. Phase 3 is about rebuilding strength, endurance, and real-world function. That can include walking progressions, exercise tolerance, return to driving, returning to the gym, or preparing for work and daily routines again. Phase 4 is all about confidence and long-term control. That means a maintenance program, flare-up strategies addressed, and a clear path for handling any triggers that may still be in your condition. At Calibration Brain Body, we use adjunctive technologies as well. Depending on your care, in your case, we may also use supportive therapies, but not just to use them, but always for a reason. So if pain or tissue irritation is making progress harder, we may use class 4 laser. If musculoskeletal tension is part of the picture, especially in the head neck area, shockwave may be useful. If you have a previous disc or nerve related issues that are affecting your function with your dizziness, we may use spinal decompression. And when autonomic regulation or neurologic patterns are contributing, vagal nerve therapies or functional neurologic rehabilitation strategies may be included. The key point is this: these are supportive tools. They're not the whole plan. The plan still has to match your exam findings, your goals, and your response to care. So a case snapshot, a good example is a patient we saw who had been dealing with more than 5 months of dizziness, visual overwhelm in grocery stores, trouble scrolling on her phone, reduced workout tolerance, less confidence in driving. She also had mild neck pain and mild to moderate headaches. Her exam suggested visual motion sensitivity, reduced gaze stability, balance confidence issues, and a possible migraine-related component. Over 8 weeks, we used personalized vestibular rehab, balance progression, home strategies, and supportive care for the neck and the body. By week 2, symptom spikes were already improving. By week 4, she had returned to light workouts and felt more confidence in driving. By week 8, dizziness was rare and she fell back to normal again. And the headaches and the neck pain got better. Of course, every case is different, but that's what a structured plan can do. If dizziness is affecting your workouts, driving, work, focus, or just your confidence in day-to-day, don't keep guessing. Book an assessment with Calibration Brain and Body so we can identify the pattern and build a plan that makes sense for you. And if you want a simple next step right now, download our dizziness guide for red flags, flare tips, and questions to ask at an evaluation.